director, as well as being the program director for the MSc OEH graduate program. Okay, so we're going to start. I'm going to start with this graphic, and to emphasize that within the population, School of Population and Public Health, we the faculty equally devote their time to research, education, policy, and practice. So that's the this nice circle that you see here. And within those thematic areas that we pursue is that there are healthcare. In some of the programs, it's more emphasized, social and cultural environment, health behavior, physical environment, and biologic factors, which all interact with each other and all intersect within the School of Population Public Health. Our program, the Master's in Science in Occupational Environmental Hygiene, as well, would touch on several of these factors. And in that way, we have a nice mix of disciplines that we cross-fertilize and find information that is easily understood and easily shared between programs. However, we do have a focus, obviously, and that focus is occupational environmental hygiene, which is a science and a study and a discipline in and of itself. So we are one of the few programs like this in Canada. We are fashioned very closely with our sister programs that exist in the United States that are funded by a national body called NIOSH, or the National Institute for Occupational Safety and Health. And so we are very proud to be offering this educational program. Our reason for being is that we make work and community environments safe through applied research and work experience. So you see here are students from just a couple of years ago. They are doing a field work, and this is the applied part. We actually do wear steel-toed shoes and hard hats and do monitoring. We are actually out in the field as part of our program. We are unusual in the delivery of our program in that we offer two options. We offer what we call the project option, which includes a paid internship or co-op in the summer between first and second years, or we offer a more traditional thesis option where students complete independent research and write a thesis. And we're going to talk way more about that in a few minutes.
Karen, can I interrupt you? Sorry, I think your slides are not moving.
Oh dear, they're moving for me, but they're not moving for you. Could you maybe, you know what? I'm going to stop sharing because whatever's happening is very odd here. I can't figure it out. And so that's not happened before. Is it possible? Do you have the backup slide deck?
Okay.
I don't know. I have no idea why that's happening today. That's the first time that's happened to me.
Oh, right. I don't have, Gina, do you have them? I'm looking for them.
Karen, do you mind just maybe trying again? I don't have them handy, but I can take a look, but you can maybe reload and it might work. Thank you, everybody, for your patience.
Yep, sorry about that, everyone. Okay, can you see my slides at this point? I'm going to try
We
to.
can see. Maybe just
Okay, now
try
I'm
to
going to
go.
try to. Yeah,
Yep.
I'm going to try to start it over again to see if I can get it up and going. Okay, and now I have no idea what's happening here. My screen is now frozen.
Oh dear.
Oh dear.
We can probably continue with where you were, and then as you're speaking, we can
Can you if
try
you
to
can
find.
if you can advance the slides? I'm not sure if that.
Yeah, just give me a few minutes to find the deck. Sorry, everybody, but yeah, I think we can continue with your discussion, and then we can resume the slides.
Okay.
Great, thank you.
Like I say, I am frozen. Okay. Well. Okay. Normally Zoom has been very good for us, and so I apologize for this. So I was saying, okay, there, at least I've got a screen view now, so that we've got project. Could Carla, could you please mute yourself? Carla, could you please mute yourself? Thank you. Graduates of our program go into highly specialized roles, research, policy management. We have alumni working in healthcare. They've been front and center in this COVID, managing the COVID crisis that's happening. It is a very broad spread of opportunities that are available to our student cohort. Okay, so the admission criteria, pretty straightforward. It's also listed on our webpage, is that we have the necessity for a degree equivalent to a bachelor's degree. Now, that's not to say that we don't look at international degree programs, we do. And in fact, if you go to the UBC Faculty of Graduate Studies, you can actually access, and it's transparent for you to see what University of British Columbia requires. We are within the Faculty of Graduate Studies. We don't call all of the shots all the time by ourselves. We are within the rules of the Faculty of Graduate Studies. So it's basically a bachelor's degree, and it's pretty competitive to get into the program. As well, Faculty of Graduate Studies has a suggested B+ average. We need 3 reference letters from, we prefer academics, but it could be a professional reference in there as well. And a letter of intent. And I'm going to come back to that and talk to that issue in a minute. A curriculum vitae is a very specific term that we use in academia. It really just means a resume. And this allows us to see you in context of jobs that you've done or professional experience that you already have. Now, if you have, excuse me, if your undergrad degree is from an institution that delivers the instruction in English, then you don't need to have other English proficiency. But if you are an international student where that's not the case, then there are a number of internationally accepted English proficiency tests that we do require the scores to be sent directly to us from the testing agency. And we do want to see that you've had somewhere in your background an ability to use quantitative values. Now, whether that's statistics or whether it's just basic math that many people have as a requirement as part of their bachelor's, or if you take what's called the graduate record exam. So the reason that we ask for this is that there is quantitative work as part of the degree program. And we want to make sure that anybody that we admit into the program is able to handle that. So we do look at your transcripts to see that you've had at least some math somewhere in your background. Now I'm going to go back to this letter of intent just for a minute. And I want to emphasize that this is your chance to tell us about yourself. Tell us about why you are interested in hygiene. One of the things I mentioned earlier is that it is competitive to get into the program. And there's a limited number of spaces that we have available, usually between 12 and 15. And in order for us to put an applicant, a person into that spot, we want to make sure that that person actually is interested in hygiene. And so this is your chance in the letter of intent to tell us about that. So I highly recommend spending some time on crafting that particular part of the application process. Now, the application is online, and you will be uploading the application, your resume or CV, letter of intent, copies of your transcripts, your references. Now, your references, typically, you tell us who your references are going to be, and then when you submit your application, UBC sends the invitation to your referees. And that's the most straightforward way to do the references. We want you to, for success, your own success, we highly recommend that you talk to your references before you list them as a reference. They're going to be able to write much stronger references if you actually make an appointment and chat with them in advance around that. And I mentioned the internationally recognized English proficiency tests like TOEFL or ITLS. And they need to be sent directly from the testing service. Please, please realize that we can't take photocopies of your test scores. They can't be shared, or it has to come directly from the testing agency directly to us. Okay, so I'm going to now say why you might be interested in coming into the occupational environmental hygiene. And at a graduate level, we want to emphasize that what we're doing is education. Now, there are many, many very good training programs out there, and we don't have any quibble with that. That's absolutely super. We need as many people as possible to look at health and safety issues in worldwide. But for graduate work, we are going to be teaching you to think for yourself, to be able to design, for example, your own sampling strategies, to be able to interpret data. And that's a big leap between education and training. So part of that is the depth. We dive deep into the basis of why policy is the way it is, or how the exposure limits, for example, are determined. So depth and mastery, we even have exercises where you design your own exposure limits, if you can imagine that. It's life and career long learning opportunity. In a 2-year program, we're going to give you some tools. We're going to give you a baseline to start from, but it doesn't stop there. Trust me. Everyone who comes through our program realizes that to be on top of the game, it's a lifelong learning. This is just the beginning of a very exciting career. And this last issue, gravitas, is kind of a funny word. Not everybody knows what this word means, but gravitas means that people will take you seriously. You will have a Master of Science designation after your name. You will also be able to qualify down the road to write professional exams like the CIH exam or the ROH exam. And people in workplaces then will take you more seriously because you are a graduate, educated, trained hygienist. Now, I've changed the photos on this slide, and the photos here look like they might be dated, and they are from a series of photos taken by a photojournalist. His name's Earl Daughter. And the reason that I included these on my slides is to say that healthcare, which is the lower left-hand photo, or forestry, at least here in British Columbia, or in the right hand, mining, these professions all have high injury, morbidity, and mortality associated with them. So even though these pictures look like they're dated, the actual impact on workers has not changed. There is still plenty of work to do out there. We have not solved the problems. So people ask, where do our graduates end up? And this is a slide. I'm hoping you're seeing my slides. Gina, are we? We're good? Okay, good. Phew. Okay. Is that from a exit survey and surveys of alumni that we've done over the years, we can say that at least of our alumni, about 31% will end up in industry. We've got people that go into consulting, either primary or working for consultant companies. Some people go into academics. They, regardless of whether you're the project option or the thesis option, have an option to continue your education. We have people that have gone into medicine with a graduate degree in OEH. We have a good number of people that go into public sector. We have a good number of people that go into regulatory bodies, for example, WorkSafe BC or other compensation board kind of environments. And then a handful that go into policy or other kinds of positions. So that is the very quick look at this, and I would be very happy to answer some questions. Oh, good, I've been able to clear my screen so now I can see you. So we're going to do a combination that if you want to write your question into the chat, I see some people are doing that already. Good for you. So we're going to have a combination of some things Shane or Gina will reply back to you through the chat, and other questions will be read out to me and I will answer them. And